Hi, I'm Adam Mortimer. I'm the Marketing Director for MGE, and for this week's tip, I want to talk about how adding just a little bit of coordination to your marketing efforts can improve the results from your marketing a lot. At MGE, we endorse very clear assignment of duties and responsibilities in the dental office, and for a lot of positions, this happens. The receptionist is responsible for greeting new patients, answering the phones, etc. The finance coordinator is responsible for billing and collections, and so on and so forth. But marketing often kind of doesn't really fall under anybody's particular job duties. What'll happen is the doctor gets an idea of something they want to try, you hire a company to do your website, or you send out some postcards. But nobody is really responsible for making sure that it all works together intelligently. And this is one of the biggest problems I find, because I'll speak with dentists who are doing marketing, they're actively spending money on marketing and doing a number of different things, and each one of those things should be working and looks fine, right? For example, a dentist will be doing Google ads, and the Google ads are working. People are clicking the ad and going to the website. But then once they get to this website, this new website that they built, it's really hard to find the phone number, and so people aren't able to call the practice. Or when they do call the practice, nobody answers the phone. It rings several times, goes to voicemail. Or I'll find out that their Facebook page was created a few years ago by some other company, and now they don't have the login information for it anymore, and they can't access their social media accounts. Or they're sending out postcards, but they don't totally remember exactly where they sent them to or how many last month. Or maybe they did some community events with local businesses or for schools in the area, and it worked great and they got some patients from it, but then the doctor didn't really have time to do it anymore and nobody followed up, and so they're not really doing that anymore. Or the biggest one, which is they're doing this marketing, but they don't know how many phone calls they got last month or how many new patients were scheduled from it. So you can see that the biggest problem is not whether or not the individual marketing activities were working or not, it's the fact that they weren't coordinated and no one was overseeing it. If you're going to spend money on marketing, it can be expensive, and it's absolutely worth having somebody be in charge of it and make sure it's being done correctly. You would never, run out of supplies for the next week, or have the wrong order come in, or completely ignore the schedule for the next 2 weeks. Well, you should have the same level of importance for marketing. It shouldn't be ignored. Someone should be in charge of making sure that it happens. Now, if you have a sizable office, it's worth it to hire a PR director or a new patient coordinator to oversee these things and work on these projects full-time or part-time. But if you have a smaller office, it may have to be assigned to the office manager or a front desk employee as a secondary job. But make sure that somebody is putting in enough time to oversee these things and do them correctly, because new patients are how you grow your office. Now, if you want to learn about all the different things you can do to market your practice and get more new patients and get more of your existing patients coming back in, come to the New Patient Workshop. We deliver this workshop in Florida, New York, and Southern California. You can find out more information at www.newpatients.net. But meanwhile, make sure you have someone who is at least overseeing the current activities you're doing and making sure that they're working properly. If you'd like more tips like this, subscribe to our YouTube channel. And you can always visit us at mgeonline.com or call us at 800-640-1140. Thanks for watching.